Is it possible for a patient to have a penile implant operation and not be happy? Possible. In fact, penile implant surgery is one of the few surgeries where there is a difference between the success of the surgery and the patient's satisfaction with the surgery. In other words, in surgeries, the success of the surgery is equal to the patient's satisfaction with the surgery. The patient who had an appendectomy and the surgery was successful, he is satisfied. The patient who had a gallbladder and the surgery was successful, he is satisfied. So here, the same success rate, if we say the operation success rate is 96%, the patient satisfaction rate is also 96%. The reality is that in the case of penile implant surgery, the operation can be technically successful, like the penile implant is in place and the incision is closed and everything seems fine, but the patient is not satisfied. The lack of patient satisfaction here can be attributed to a lot of factors. These factors will be thoroughly discussed in a separate program, in a series of dedicated episodes, but the most famous reason for the patient's dissatisfaction after the operation is the inaccuracy in choosing the size of the penile implant, whether the size of the penile implant is larger than necessary or smaller than necessary. The smaller than necessary is what we see a lot recently. Under the pretext of preserving the cavernous tissue later, patients may become dissatisfied and tissue erosion occurs around the penile implant. The patient complains that the organ has shrunk, weakened, and lost flexibility, often resulting in penile implant fractures. As a result, we have to remove the initial penile implant and replace it with an appropriately sized one. Thus, the most critical aspect of our procedure is selecting the right size for the patient. That's why companies have produced varying sizes. How do I know the patient's size? Through dilators, the length is already measured. But how do I measure the diameter? I put the dilator, I put size 10, I found it easy to enter. So it's okay, I put size 11, I found it easy to enter. I try 12, I found it easy to enter. I try 13. As soon as I find the dilator enters with difficulty, then that is the patient's size. What does it mean that it enters with difficulty? That there is no more space between the dilator and the wall of the cavernous body. As long as there is a space between the wall of the cavernous body, then this is not the right size for the patient. As long as the dilator enters and rubs against the wall, then the tissue has completely disappeared and no longer exists. Then this is the right size for the patient. This is what the books say. This is what the whole world is doing. There is no such thing as pushing the tissue aside and putting the penile implant next to it. And when I remove the penile implant, it comes back. These are the nonsense that we hear from many doctors. So how do I know the size? I insert the dilator and find it difficult to enter, then this is the size for the patient.